Folks, here we are again looking at a somewhat weird case in the world of diffuse interstitial lung diseases. This is what we see week in, week out at the Brompton. So let's have a look. As always, first thing I do is look from top to bottom so that I get a feel for where the disease is most prevalent. I think we can probably agree that this disease, if you look here, we look here, is more marked in the upper zones. It's not just an upper zone prevalence, though. What it is very bronchocentric. And that word bronchocentric is crucial, because when I say bronchocentric, what I really mean is this is a disorder which impacts or affects mainly the lymphatics of the lungs. And as you know, the lymphatics of the lung are very rich around the bronchovascular structures. So we have an upper zone predominant bronchocentric disease. Then it's a matter of actually dissecting out the patterns. Now, what are the actual patterns that we're seeing? Well, I think you will appreciate that there are these tubes here, and that those tubes, which are, as you know, airways, are actually dilated. This is the sign of traction bronchiectasis. So whatever else is going on in this lung, we know that this is a fibrotic lung disease. There are a couple of other signs that I want to point out. Firstly, there are these bands of what I call loose reticulation. And I think this is something that we see in this disorder that I'll come to in a second. The other sign, which is not in the textbooks, which is one that I've noticed, is this sign of reversed signet ring. Now, I know when you hear signet ring, the instant reaction, particularly of registrars, is to say, I've seen bronchiectasis. Well, actually, this is reversed signet ring. In other words, what you have is a vessel that is bigger than the accompanying airway. And that reverse signet ring is something that you see coupled with this bronchocentric fibrosis and also this loose reticulation pattern. I'm sure you already spotted that there are calcified lymph nodes in the mediastinum. And you put all of this together, and what you have is a diagnosis of pulmonary sarcoidosis. And this is fibrotic pulmonary sarcoidosis. This is a common phenotype that occurs in pulmonary disease in patients who have sarcoidosis. So there you have it. Another case of diffuse interstitial lung disease. Bizarre to start with, but work out the distribution, work out the principal patterns, and you can come to a correct diagnosis.